Welcome to the Orthomind Podcast, powered by our team at FARIL. I'm Nate.
And I'm Alexia.
And I'm Audie.
Today, we're honored to be joined by Dr. Jeremy Smith, a foot and ankle surgeon at Mass General Brigham, associate professor of orthopedic surgery at Harvard Medical School, and the director of the Harvard Mass General Brigham Orthopedic Foot and Ankle Fellowship. Throughout his career, he has been deeply involved in helping surgeons adopt new techniques and technologies, while also leading efforts to reduce healthcare's environmental footprint and promote more sustainable practices in surgery. It's great to have the opportunity to talk with you today, Dr. Smith.
Thanks, Nate. Alexia, Avi, thank you.
Okay, to start off, many people think of surgical training as a period where you learn the vast majority of your skills. But some of the biggest changes in orthopedics happen after fellowship, when you're already in practice and responsible for your own patients. When you think back on your career, when did you first realize that becoming an attending wasn't the end of the learning process, but really the beginning of a new phase of learning?
That's a good question. When I was in training, the fact that it would be a continual learning process was relayed to me by my mentors. And so I think I had a sense that that was coming and that was going to be the case. That said, nothing really sets in until you experience it for yourself. And so for me, it was the answer to your question was immediately. So right when I started out, which was essentially the week after I finished my fellowship training, all of a sudden I was seeing patients independently and I was doing surgery independently, really for the first time. And you have some autonomy as a trainee, but it's dramatically different from when ultimately you're the one responsible for making the decisions and for executing whatever plan you and the patient come up with. And so I quickly learned that I was immediately going to need to evolve and learn as I was essentially on the fly. In fact, the first patient I took care of surgically, my first surgical case, was something I had never done before. And so it became very clear to me that I needed to learn techniques on the fly, so to speak. Now, that's not to say that my training wasn't thorough. It's just that what we do, particularly in orthopedic foot and ankle surgery, is so broad and diverse that there are going to be things that as a trainee you just don't see until you're in practice. And so you have to be willing. You have to understand the foundations, but you have to be capable of learning new techniques and evolving as you go, such that you can take care of whatever next problem presents itself. So for me, it was absolutely immediate because I had to read and I had to learn and I had to figure out how I was going to take care of this patient, which was like the first or second week of my formal practice. And then that whole thing where your mentors and trainees tell you that it's the practice of medicine, which is a little bit tongue in cheek, but I think it's actually a real thing. You're learning, you're evolving, and you're building new skills as you really evolve throughout your practice over years and decades, actually.
That's great. Thank you so much. And how has your approach to learning kind of evolved from your early career to where you are right now?
It gets harder to learn new things. When you're starting out, I think as a trainee and then early in practice, there's so much that's new and coming at you fast and furious, things you're not familiar with. That you get into a mindset and a zone, kind of in some ways, of learning, of reading for every case, of preparation. And as you get more comfortable with your skill set, whether that's decision making or for surgeons, surgical technique, it gets harder to then apply yourself and learn new things. You kind of need to downshift or something or step back and try to remember those old skills that you had from when you were a student. And so it actually requires, at least I found, more sort of, there's inertia, so it's like more personal effort to get started on that. So for me, it's the habits I learned before. It's applying those again and being willing to sort of dig in and really do that. And I can think of examples of that many where I feel that I've wanted to try a new technique or surgically and have to apply myself and learn how to do that, whether it's by initially reading about it or watching videos or subsequently practicing in a cadaver setting, in an environment where you feel like you're safe and you're not actually going to be practicing on a patient, right? so that whole exercise, you kind of do it accelerated, because instead of learning it over 5 years during residency, you're learning it over, a few weeks or months or whatever, until you're actually going to apply it in practice. Or it can be decision making, right? So seeing a patient in the office, which still happens, who has a problem that is something that I may not recognize immediately or be familiar with. That's uncomfortable once you've been doing this for a while, because you're used to seeing things that you recognize, right? And so being aware of that, and open to the idea of sort of stepping back and maybe reading or opening a textbook or going online or whatever it is, and trying to apply some of those old habits, which does get harder as you move through the process, but it's really important, I think, to try to keep those skills and willingness to and habits, really, to keep those fresh.
Thank you so much. It's great to hear. And specifically, orthopedics is constantly evolving, whether it's new surgical techniques, new implants, new technologies, or kind of just new ways of thinking about patient care. How do you evaluate whether something new is worth incorporating into your practice versus if it's something that might just be a temporary trend?
Another really good question. So orthopedics is big business, right?
Mm-hmm.
So there's a lot of there's a lot of money in orthopedics. There's a lot of interest in innovation in orthopedics, and not everything that is thrown at me or at somebody like me or at our residents or trainees or fellows or whatever is the next big thing. And so the question really is driving at how do you weed through that and decide what's worth adopting and what's not. The core of it is being able to and understanding the literature. And so if you develop skills as a trainee and maintain those skills in practice, about interpreting literature, critically reading the literature, and understanding what you're seeing, that's really the foundation of understanding what new techniques or new devices or whatever it is are going to be worthwhile adopting. So that's the foundation of it. I think the other thing that I've learned is that you have to be aware of who's promoting something, right? And so this is obvious, but it's sometimes harder to do than we want it to be. But keeping track of who is telling you that this is the next greatest thing, or who's promoting it, is really important. And that could be, a rep from industry who's telling you that something's great, and it could be in a meeting that's sponsored by industry, and it could also be a colleague that you respect, and so understanding sort of what their biases might be, if there are any, is really important. And please understand, that's not to say that if a rep is telling me something is great, that it's not. It may be fantastic. But at least acknowledging and recognizing that, I think, is really important, so you understand who's trying to sell you on something. At the risk of being long-winded, I guess I'll keep going. But I think a third piece of kind of thought on this is that I've always adopted the mantra that you don't want to be the first or the last to anything, right? So, and for me, I've really tried to take that to heart. So I personally, I'm somewhat conservative when it comes to the things I do surgically, and so I don't want to be the first one out of the gate who's trying something new and no one's ever seen it or done it, and this is going to be amazing, right? Like, that just doesn't sit right for me. But I also don't want to get too stuck in my ways, and this gets at what you were asking about before in terms of adopting new techniques and technologies, right? So I don't want to be the last one, and for me, that's worked out well so far. I mean, I can think of multiple examples in my practice where I've it's been hard, but I've taken on new problems or things that I wasn't necessarily comfortable before, or wasn't even aware of. And that involves, again, all the steps of learning the techniques and then applying them. And an example of that in my tenure is minimally invasive surgery. So minimally invasive foot and ankle surgery was not something that many people were doing in the United States when I started. I'd never heard of it or seen it even when I started in practice 13 years ago. And then, my colleagues started adopting it. And then 6 years ago, I sort of meaningfully dove in on it, or roughly 6 years ago. And it's become a really important part of my practice in terms of how I take care of patients. And again, that exercise was difficult, but I feel like I sort of followed my my principles of studying the literature, listening to who's promoting it, not being the first or the last. And then I've been really extremely happy with what that's done for my practice and in terms of how I care for patients and getting good outcomes and all the other additional benefits of that particular thing. So there's that, and there's other examples too of how it's, I think, really helped me to take on new challenges and new techniques.
Nice. So learning something new yourself is one challenge. Helping an entire department, residency program, or profession adapt can be much harder. As someone who trains with fellows and residents, what have you learned about helping people become comfortable with change and continuous improvement?
So I think it's easier for trainees to learn new techniques and because they're doing it constantly, right? So our fellows, for example, who come in have just spent 5 years learning new stuff constantly. And some of that is like hands-on orthopedic stuff with surgical techniques, and some of that is understanding disease processes and anatomy. And some of that is also just like learning new computer systems, right? And like silly stuff like that goes along with practicing medicine and, now. So I actually think it's really easy for the trainees easier, I think, to adopt to new things. And so than it is for somebody that's been in practice for a long time, for all the reasons I mentioned previously. I also think that modeling a willingness to learn new things is really important in terms of demonstrating to trainees that it's okay to learn new stuff and learn new things, and that's part of the process and the evolution of how we care for patients. And so for me, I feel like the trainees, I sometimes wonder what they really think about me when we're operating together, because I ask them a lot of questions, and it's not to pimp them or whatever it is, but it's questions meaning like, do you think this is good enough? Or what do you think about trying it this way? Or can you, I know you did that with so-and-so, one of my colleagues, the other day, like, before we do the case, like, tell me what that might look like. And then let's think about whether we might consider incorporating that into how we do this. And so I hope that by demonstrating my own willingness to try new things within the confines of what's reasonable and safe, is illustrative of sort of a willingness and a model of taking on new challenges and techniques as you move through things. And frankly, I think where our division of faculty, which is big, is we're collectively a group that I think is very open to trying, and I shouldn't say trying, but learning new techniques and kind of pushing the innovative side of orthopedic foot and ankle surgery. And so I think that our trainees are not just seeing it from me, but rather they're seeing it from collectively the group. And I think that I would like to think that's very powerful in terms of just understanding the importance of learning new things and evolving as you continue to practice.
That's great. Thank you.
So what drew you uniquely to foot and ankle surgery, and what do you think makes the field especially challenging or rewarding?
So when I was going through residency, I was not mentally committed to one field. Some people are, but for me that was not the case, and I frankly probably would have been happy doing quite a few different things. What really made foot and ankle stick for me was a couple things. And first and foremost, it was the community of foot and ankle surgeons. So I think at least for me personally, as a trainee, you sort of connect with people. And this is true in medical school when I was thinking about what kind of a residency I wanted to do as well. So for me personally, as a resident, I really felt that I could identify with the foot and ankle surgeons that I met and who then became my mentors in a way that really stuck for me. I had the opportunity to go to a Orthopaedic Foot and Ankle Society meeting as a resident, which was so great. And it was in Keystone, Colorado, and I didn't really know anybody. None of my co-residents were there, but I knew some of the faculty, and they were so great about introducing me to these other leaders in the field. for me, that was a really awesome experience to see these people whose names I read and whatever, and now all of a sudden I'm like having a normal conversation with them, and the community at large was so welcoming and open and humble. And those are things that really like spoke to me. So it was really first and foremost, it was the people that kind of got me excited about it initially. And then as I did rotations in foot and ankle, and I found myself gravitating more and more to it, I really, really like the fact that you can do many different things. So although you're sort of constrained anatomically, you're doing all these different types of procedures, and I liked that you could do those things. And in my practice, I continue to really love the opportunity to, do sports foot and ankle stuff, and to do fusions and do deformity correction of forefoot and hindfoot and joint replacement. I mean, it's and the list goes on, but it's really cool, I think, to be able to incorporate all those different things and feel like you're good at all of those things. And so for me, that was something that really drew me to foot and ankle.
I see. Thank you for that. And just as a follow-up, when you think about the most meaningful patient outcomes that you've had in foot and ankle surgery, what matters most to you beyond the surgery in regards to specifically patient outcomes or patient recovery?
Sure. So how patients perceive themselves to be doing does not always correlate with how I might think that they should be doing, right? And maybe that's a little convoluted, but an example of that be sometimes you look at an X-ray and you might say, well, I'm not sure that is great, and the patient will be really pleased with how their foot is functioning. I think all of us who do this kind of work would have had that experience. And the other side of that coin is true as well, which is that you might look at an X-ray and it looks perfect, and you're sort of ready to go in and high five the patient, and then they say, well, they're unhappy or they're painful or whatever it is, right? And so I think that what I've grown to understand more and more, and will continue to learn, I think, the hard way, is that patient expectations going into surgery are really critical in terms of predicting outcomes. And so, one way I try to sort of relay that to patients is that if you are 95% functional, so you're 5% unhappy with, let's say, your ankle, the reality is it's going to be really challenging for me as a surgeon to give you that, any sort of meaningful improvement. Because to get you from 95 to whatever you'd say it's worth it, to get you to 98%, like that's going to be really hard for me to do. Whereas if you come into me and you're like, by whatever metric, you say, hey, look, I'm 60% functional. My ankles, this is terrible. I'm 60% functional. Whereas you might otherwise say, this is terrible. I'm 95% functional. But you say I'm 65% functional. We have a lot of room. If I get you to 90%, you're thrilled, right? That's a very positive outcome. Alternatively, I get you the same outcome and you start at 95%, and you're going to be really unhappy about your experience because you go through this whole recovery and inconvenience and whatever, and now you're worse. So one thing that I think is really important is this is one of the challenges, which is another question you asked, is one of the challenges taking care of patients with foot and ankle problems and orthopedic problems in general, is really making sure that their expectations align with what you feel like you can provide. Or if they don't understand it, having them understand that there's uncertainty or unpredictability in terms of how this is going to go and where they're going to end up. And for me, that's probably been the biggest learning point, is how to sit with patients, just in terms of patient care, is how to sit with patients and try to learn how to extract from them really what their limitations are, what their aspirations are, what their tolerance for risk is, and that all feeds into whether it makes sense for you and the patient to embark on a journey together, which is, for some patients a surgery and for others it's not. Right?
Yeah, 100%. Thank you.
Sure.
So one area where you've been particularly passionate about challenging established practices is environmental sustainability in healthcare. What first drew your attention to the environmental impact of orthopedic surgery, and why do you think this issue deserves more attention than it's currently getting?
This goes back to medical school for me when I was in my first couple of years in medical school, and I got connected with a group of other first year or second year medical students who are interested in sort of public health and environmental sustainability issues, specifically interested in the healthcare or health implications of environmental change. And we founded a group called Students for Environmental Awareness in Medicine, which I'm super excited that is still in existence. This is kind of amazing because I've been at this for a while. They're still there doing good work. At least their website says they are, and that's really exciting for me. But SEAM was an organization we started together with a group of about 10 medical students, and I was involved in that. And for me, that was sort of a meaningful part of my medical school experience. And then in reality, I kind of in practice drifted away from that being a part of my experience during residency, because you're so involved in all the things of being a resident in terms of learning your trade and skill set and all this new material, which is in orthopedics. But then I've had an opportunity to sort of recycle back to those interests, and over the recent years in particular, maybe the last 5 years or so, and particularly applying those same kind of ideas and interest in sustainability work into orthopedics. And so for me, that's been really kind of a fun circle for me to come back to this. I've had some of my partners in orthopedics and specifically orthopedic foot and ankle surgery are like-minded in terms of being interested in these, and so it's been really fun to collaborate with them. And then working with the younger folks than I am has been really great also. And so I've had really the fortune of working with some very inspired medical students, including here at FARIL and elsewhere, who are interested in sustainability efforts. And our research, one of our kind of research coordinators, did a ton of work on this with me. And so it's been really fun to try to figure out how to apply sustainability to orthopedics. Orthopedics and environmental sustainability in medicine are like two separate things, right? And that's okay, but there's not a lot of overlap. And that you might say the same is true for sort of healthcare in general. Healthcare is a huge generator of environmental waste and energy expenditure, right? And then within healthcare, which is that's a huge thing for energy expenditure, let's just say, within that, the operating rooms within which I work are one of the biggest generators of waste and energy expenditure within healthcare. And then within the operating room, orthopedics is a huge generator of waste and energy expenditure within the operating room. So like if you think about my impact as a surgeon, it is substantially higher than most just by virtue of what I do. And I recognize that what I do, and I feel that it's valued and important and really critical for patient care and for all, for many reasons. And I've been an orthopedic patient myself, and I appreciate the importance of it, obviously. But for me, it's been neat to think about opportunities of sort of trying to make the operating room a greener place, or think about opportunities to make what I do more environmentally sustainable, and therefore hopefully helping to curtail climate change to the extent that I can in my little bit. So again, orthopedic surgery is here. This whole effort of like sustainability and healthcare is here, and I'm trying to kind of bridge the two of those together to a certain extent. And there's a lot of people that would like to do that, and I think it's a little unclear how to make those connections and bridges. So getting to know people, working in this sphere has been really neat for me. And so we've done a number of projects to try to kind of mesh those two together.
Mm-hmm. Thank you.
So just following up on that, it seems that like a common theme throughout our conversation here today has been a willingness to continuously learn, adapt, and also kind of challenge some assumptions that we have in medicine. When you look ahead 10 or 20 years from now, what changes do you hope to see in orthopedics, not just in terms of technology, but in how surgeons are approaching learning, innovation, and kind of like, as you said, stewardship of healthcare resources?
Well, I think the reality is we're going to be doing things differently in 10 or 20 years than we are now, for sure. And when people said that to me like 10 years ago, I'm like, whatever. Like, we'll see. That may or may not be the case. But I actually really have come to believe that. And I don't know what it's going to look like. I mean, our techniques have changed. We're doing things surgically through smaller incisions as compared to 5-10 years ago. Maybe it keeps going that direction. I don't know. I just know it's going to be different. And so I think a willingness, as we talked about, to being open to change, welcoming of change, a critical eye and an analytic approach to understanding new techniques and new ideas is really important as we kind of have all these forks and we try to go decide which path to take in terms of what healthcare looks like, but on a policy level, but also on I'm thinking about how I fix your ankle fracture level, right? So, but I know it'll be different. I do hope that you mentioned stewardship. I do hope that environmental stewardship it becomes a larger part of how we think about spending our healthcare dollars and how we practice medicine. Unfortunately, I don't think the whole environmental climate or environmental picture is going to get better in the coming years, and I hope that we can have kind of an honest dialogue and approach to the impact that our healthcare system impacts environmental change and an openness to kind of welcoming new ideas. I mean, innovation and dollars drive a lot of things, but I would like to think that there is a willingness to innovate in the space of environmental sustainability that within orthopedics maybe also means generating some neat new approaches to caring for problems in a different way within orthopedics that are environmentally sustainable. I hope you can follow my train of thought there.
100%.
I think I'm following it as I'm saying. but so I don't know how it's going to be different, but I hope that I think that the people that are going to kind of lead in 10 or 20 years are going to be those that are most open to embracing change. And then, of course, on my own little sustainability soapbox, hope that they're willing to, embrace principles of sustainability from an environmental standpoint and a cost standpoint. And those often couple.
See.
Yeah.
And just as a follow-up to that, given the fact that, you're talking about the future of medicine, if a medical student or a resident or even attending or surgeon is listening today and they wanted to build, a meaningful career in the sense that, they can look back at it and be happy about it, be happy about the impact that they had in the field, whether it's a medical student, resident, or a surgeon. What mindset would you encourage them to develop so they can build towards that?
It's an interesting question. So everyone's going to be a little different in terms of what matters to them. And that's great. And that's totally fine. And so what drives me is not necessarily what might drive you, Avi, or anyone, right? And so I think my first advice would be attempting to clarify what motivates you more than anything else. And if that's innovation, then great. If that's research, then great. If that's patient care, then great. So trying to come to understand what really, not what you think other people might, I know it's not really about you, but what you might think that other people think about you or what they think that you might want to do, but rather what really motivates you and drives you. I think that's going to translate into what's satisfying and gratifying for an individual. And I would also say that, we're here and, I do, medical education and I do research, whatever, and I do a lot of patient care and not everybody does that. And some people do more patient care than I do, and that's their sole focus. And that is awesome. And so at its core, it has to be about what's satisfying to that medical student and what's going to really translate into satisfaction for that person more than anything else. And if it's just patient care, that's just great. Then be really good at your job, take great care of patients, have super happy, gratified patients, do the best you can. And at the end of the day, then that's what's going to make you satisfied. Is understanding what drives you and then applying it.
Thank you.
And kind of to finish off, now that you're the director of the Harvard Mass General Brigham Orthopaedic Foot and Ankle Fellowship, you're kind of in a unique position to inspire future foot and ankle surgeons. What are your visions for this program in the upcoming years, and how do you see research playing a role?
Yeah, no, I'm very excited to be in this role. This is a great opportunity for me. This is a bigger program than the existing fellowship programs are. They're kind of merging together, right? And so I think as part of that, we're building a momentum where we have more people and more faculty, more fellows, so more trainees. And with that comes the opportunity to sort of build this momentum in terms of the experience overall. So it's more collaboration, it's more camaraderie, it's more opportunity for learning, and then it's the tangible things like more cases and more patients that we're helping, and so I'm really excited about the prospect of just kind of growing things with this collective energy that I think we're going to get from having a bigger pool that we're all swimming in. I think to your question about research, I think that's another part of this, that just having more minds and more energy, I think, is going to lend itself to more opportunities for research. Since our two academic medical centers have merged, we're now doing more conferences, and we're collaborating more, and we're interacting more with a bigger group of faculty. And even in that little kind of small snip of time, I think I've really appreciated the kind of an understanding of the research, the volume of research being done by my colleagues, and hopefully them by stuff that I'm working on and things that gets me excited. And within that, you can build kind of a collaborative energy and opportunity for new ideas. It becomes like a think tank, so in some ways, and I think there's just going to be hopefully this exponential growth in terms of all the opportunities for our trainees, and also for us as faculty. And yeah, I'm very excited about it. I think it's going to be really cool.
Well, Dr. Smith, we'd love to thank you for your time today. It was truly a pleasure to have you here on this podcast, and we wish you success as you continue to be an inspiring surgeon and a leader in this field.
Thanks. Thank you all.
Thank you.